The sharp rise in stimulant prescriptions for ADHD in adult women, particularly those over 35, has raised concerns among researchers and medical professionals. While many see this trend as an overdue response to undiagnosed cases, others worry about the potential risks of overprescription, dependency, and long-term consequences of stimulant use. The increase has been staggering. Between 2019 and 2022, the number of women aged 35 to 64 receiving prescriptions for medications like Adderall and Ritalin jumped from 1.2 million to 1.7 million. The shift has been attributed in part to greater awareness, improved diagnostic criteria, and easier access to telemedicine. However, the medical community remains divided on whether this trend reflects a genuine rise in ADHD diagnoses, or if societal pressures and changing life circumstances are leading more women to seek pharmaceutical solutions. One of the most alarming aspects of this surge is the potential for dependency and misuse. While older women have lower rates of stimulant abuse compared to younger individuals, the overall statistics remain troubling. More than 25% of adults with ADHD prescriptions admit to using the medication in ways that deviate from medical guidelines, whether by increasing doses, taking the drug at inappropriate times, or using someone else's prescription. Among those prescribed stimulants, nearly 9% meet the criteria for stimulant use disorder, a condition characterized by dependency and difficulty stopping the medication despite negative consequences. Stimulants like Adderall, which contain amphetamines, have been found to carry a higher risk of abuse compared to alternatives like Ritalin, which contains methylphenidate. The rapid growth in ADHD medication use among women also raises questions about the accuracy of diagnoses. Historically, ADHD has been underdiagnosed in women because their symptoms often present differently than in men. Instead of hyperactivity, women with ADHD may struggle more with inattention, internalized anxiety, or emotional dysregulation, making their symptoms less obvious in childhood. Many of these women manage to function without medication for decades, only to find that the pressures of adulthood, careers, parenting, and hormonal changes bring their challenges to the forefront. While some specialists argue that this means ADHD was simply overlooked in these women, others caution that life stressors alone should not be mistaken for a neurological disorder requiring stimulant treatment. A key concern is the role of hormonal changes in this trend. Some experts suggest that declining estrogen levels during menopause may contribute to cognitive difficulties, particularly in areas like focus and memory. Estrogen is closely linked to dopamine production, the same neurotransmitter that ADHD medications target. As estrogen declines, some women may experience ADHD-like symptoms for the first time, leading to new diagnoses. However, this raises an important question. Are these women truly developing ADHD later in life? Or are they experiencing cognitive shifts that could be managed through non-pharmaceutical means? If hormonal fluctuations are the root cause, alternative treatments such as hormone replacement therapy or lifestyle adjustments might be more appropriate than long-term stimulant use. Another factor fueling this rise in prescriptions is the accessibility of telemedicine, which expanded significantly during the COVID-19 pandemic. Virtual appointments made it easier for adults to receive ADHD evaluations and prescriptions, but they also led to concerns about misdiagnosis and overprescription. Some online providers have been criticized for offering quick, superficial assessments that fail to consider broader mental health conditions or alternative explanations for symptoms. This has raised ethical concerns about whether some women are receiving medication without a thorough evaluation, increasing the risk of unnecessary stimulant use. Despite the belief that women use ADHD medication responsibly, there is still the potential for misuse and dependence, especially as stimulant tolerance can develop over time. Stimulants provide an immediate boost in focus and energy, which can be highly reinforcing, leading some patients to escalate their use beyond prescribed doses. Additionally, while these medications can improve attention and impulse control, they can also cause side effects such as anxiety, insomnia, increased heart rate, and appetite suppression. Long-term effects remain an area of concern, as research on the prolonged use of stimulants in older adults is still limited. The growing reliance on ADHD medication in adult women calls for a more critical examination of how these drugs are prescribed and managed. While some women undoubtedly benefit from stimulant treatment, The sharp increase in prescriptions raises concerns about whether ADHD is being overdiagnosed or if external pressures, such as career demands, family responsibilities, and hormonal changes, are driving more women toward medication as a coping mechanism. There is an urgent need for more rigorous diagnostic processes, increased awareness of alternative treatments, and careful long-term monitoring of stimulant use in this population. Otherwise, the current trend could lead to unintended consequences, including medication dependence and potential long-term health risks that have yet to be fully understood.